My name is Alexander Parker. I come from Elysium Medical in Oslo, Norway. We are here in Barcelona and visiting Dr Hilu. He's the best doctor in the world of analyzing the blood. He's also one of 2 doctors in the world that does an absolutely fantastic stem cell surgery. So, Dr Hilu, thank you for seeing us.
It's my pleasure.
Yes,
Alexander.
Thank you. So, what is this behind me here? Can you explain?
Well, this was made by one of my friends, a French doctor, in fact. He took pictures of the blood before and after a specific therapy for oxygenation. The very red bits is dried blood. It's a blood that is taken in a different way in order to study under the microscope how it dries, how it coagulates. So it's a coagulation test. The rest is the lifeblood, the fresh blood, the normal blood cells that you study under the microscope that any hematologist or lab expert would be looking into. The only difference is that we look at different morphologies, behavior. We don't count things. It's not a type of analysis to know how many red blood cells or how many white blood cells. It's a type of analysis to see what's in there and what is it doing and is it right. And if it isn't, we decide what to do to make it look right, which would be the picture on the right.
So what is that morphology?
The shapes. And even the size is important. The size of a red blood cell. If it's very small, if it's very big, if it is elliptical in shape, if it looks like a teardrop, if it's square, white cells likewise, and the content of the serum also. The serum, the plasma should be clean. If it contains certain particles that shouldn't be there, this will also be giving us information about what organs are doing what.
I see. So, you're the best doctor in the world of doing this.
That's what you say, and some others as well.
Yeah.
Thank you.
Because it's all about reading the morphologies. So, it all depends how many morphologies you can look, the better you will be.
Yeah, that's true. The more information you get from the analysis, the more you can help the patient. It is true that most of cellular analysis experts can read less than 60 morphologies or 60, get 60 pieces of information per sample. After 20 years of investigation on our centers, we can read more than 800 morphologies. There's a lot of work behind this. There's a lot of investigation, help from other labs to double check that what we are seeing corresponds to this, that, or the other. In this regard, yes, we do read more morphologies than anybody else. If this means that we are the best, then you are right. If it means something else, well, it will be that something else.
Okay, fantastic. What types of illnesses can we treat with this type of method?
Your question is very good, because if you asked me what type of illnesses can we see, I would have said none. Because we don't see the illness. We see the cause of the illness. We don't see labels here. Oh, look, here's fibromyalgia. Oh, heart problem. It doesn't show like this. But the factors, the risk factors that cause any illness will show. Because illnesses do not happen just like that. Before an illness occurs, things go wrong. The things that go wrong, we know how to read them. Once we find what things are wrong, we fix them. Once they are fixed, the illness disappears. Or the tendency towards that illness, and that's my favorite part, which is preventive medicine, then we can avoid a cancer to happen or a heart attack to occur or what have you.
Amazing. If let's say if I have cancer, what kind of success rate will I have if I have, let's say, pancreas cancer? And what type of success rate do I have? in general with this type of disease?
Well, this is something else. This is not 100% related to the blood analysis, because in the blood analysis we would find out the cause of your cancer, whichever cancer it is, even if it's pancreatic cancer. We'll go to the base of the problem. But it all depends how advanced the disease is. If it's too advanced, we cannot do much in favor of curing the patient. We can help the patient get better. But after many years of experience and work with other doctors and other colleagues that they are the best in what they do, we have got to know the best in almost every type of treatment. For instance, regarding pancreatic cancer, there is a radiosurgery center in the United States, in New York, that's specialized in treating pancreatic cancer by means of a special type of radiosurgery. And they have a very high success rate. Normally, success rate in pancreatic cancer is 2% with the traditional methods in advanced pancreatic cancer. And with this stereotactic extracranial radiosurgery they do in New York, they are exceeding 95% of success rate. But this is not the blood. This is the technology that is used to treat the patient. And even if we go back to the blood, there are two readings to it. A good doctor probably is very good at analyzing. So I know exactly the cause of your disease. It's this. Be it with a blood reading or with any other method. Now, what do we do with this? What do we do for the patient? Are we sure that what we are going to do is the best for the patient? Now, this is not blood. This is experience, this is investigation, study, and I don't think I'm the best in that. I'm good, but I'm not the best in that, because I've spent most of my time investigating the reading. We have very good results in treating patients. We are exceeding 80% success rate in general. Wow. But it's not me. It's my medical team, medical devices, and my supervision. Yeah. So I'm not that brilliant in the treatment, say. In directing the doctors and the medical team, yes. In looking at the causes, yes.
How does the process work? When I come in, after the treatment, how is the process?
Well, let me start from scratch. The process is the patient would have to call or send an email asking for an appointment. They get the appointment. It depends what clinic. It's harder or easier. Right here where we are now in Barcelona, the waiting list is about 1.5 years. So it's almost impossible to get an appointment for someone new. Practically all appointments are for already existing patients that come for checkups and to see how they're doing with their treatments and if there is a need to change anything. We hardly can take any new patients here. Here in Barcelona.
So that's October 2017 then?
Yes, if you want, we can take note of your name and we see you next year. In Marbella, it's a little easier because of two reasons. One of them is that I live in Marbella, so I can always make an exception. Normally, I don't, except when it comes to cancer patients. Then I do make the exception, and even if we are overbooked, I would eliminate lunch, dinner, or breakfast, or rest, or whatever, and I would take them immediately.
Fantastic.
So there's no problem there.
Other illnesses like arthrosis and MS and Parkinson, Alzheimer, what kind of can we help these types of diseases as well?
Yes, in fact it's the same story, Alexander. As I've just already mentioned, the reading of the blood is not going to tell us here's the Alzheimer, here's the Parkinson. It's not a reading for the disease. It's the reading to see the cause of the disease. So we are very, very lucky to be able to tell in each case what's behind their disease, which makes life much easier. So it doesn't matter what the disease is, we can always help them, without exception. Even if it's a disease of unknown origin or it's a disease that has no name, it doesn't matter. The procedure will be identical. So after they make the appointment, wherever they do so, we take 1 drop of blood from their finger, put that under a microscope, a specially adapted microscope. It's an optic microscope, not electronic. And we magnify the sample up to 65,000 times, and we start looking for defects. And I would be reporting to the patient the defects, the irregularities, the imbalances, whichever ones they are. I would exactly explain to them what is wrong on a cellular level. Once this is finished, it takes about 20 minutes to do the full study, both the coagulation test and the live blood test. We do it also with other countries because the sample holds for 10 days in perfect condition. So it can be studied later, a few days later, without any problem. So once we know what's wrong, between 0 and 842 different possible irregularities, we put that on a written report so that we don't forget what we saw. And I start to look at methods to correct everything that's wrong. Because many times, and we are still very much behind when it comes to knowledge of the causes of diseases. Many times the cause of a disease is a minor issue that we saw in the blood, but we didn't know it was related to the disease. So the philosophy we use at our clinic is whether we understand if this is related or not to the disease, we treat everything that's wrong. Because everything that's wrong is going to be harming the patient, whether related to the disease or not. So we try to fix it all. That's why our success rate, as I mentioned, exceeds 80%, because we're fixing almost everything that's wrong in them. So of course they're going to get better and be cured, even if we don't understand how this is happening. So we try to correct everything. We use different methods to correct. Easiest, diet adjustment. We are what we eat, so the more precise the eating habits, the more adequate the eating habits and what we put into our body, the better the body would react. That's number one. Number two, if it's not enough with diet, we help the patient out with additional supplements because his body is unable to take everything from food. We help the patient. Number three, if number one and number two are not enough because the patient is weaker than that or the disease has gone a little bit further, we use specific medical devices. We use many of them. There's a long list of devices that help the body recover. And if 1, 2, and 3 is not enough, then we have a big consultation with our medical team to see what else we can do. If we still don't know what to do and things are complicated, then we contact big brains like this oncologist in New York or other centers that are specialized in other diseases to give us a hand or to help the patient directly with their problem.
With all these techniques, are you able to reverse these diseases like MS or Parkinson, or is this possible?
The answer is yes, it is possible. What varies is what could happen from one patient to another, because every single patient is different. If the deterioration of the organ that's responsible for the disease is beyond 50%, i.e. beyond recovery, then we cannot cure the disease. It doesn't matter what the name of the disease is. If it's in earlier stages, yes, we can help the patient recover health. But even in advanced stages, we can always help the patient to get better. Probably not to be cured, but yes, to have a better quality of life, to shake less, to have a little bit better of memory, to have longer hours pain-free, and depending what we are talking about.
Do you look at this type of diagnostics one of the best tools in the world to analyze, to look at people's health?
Preventive-wise, it is the best tool to treat people who are already following a treatment, a chemical treatment, and they are being looked after by other colleagues, by other doctors, by other specialists. It's a complement. It's a complementary checkup. You cannot work with it alone because you don't want to ruin the work of other doctors. So you need to base your work on the medical reports the patients would bring with them and on the hemograms and the other blood analysis and whatever medical information we get from them. And in addition to that, we use this technology to help them out.
What other types of specialties do you have? You have stem cells, correct?
Yeah, I only do two things. The one that we've just mentioned was cellular analysis, the study of the blood under microscope, and the treatment that would be set up in order to correct whatever is wrong that we have seen under the microscope. And the only other thing I do is stem cell surgery. I only do autologous stem cell surgery. And I only do autologous stem cell surgery that I carry out in the operating theater without sending the bone marrow away. We set up our own lab inside the operating room, inside the operating theater, and we do everything in a closed circuit. Nothing leaves the room. This way, it's not a transplant. It doesn't need paperwork. It's like taking blood from one side, putting it another, or taking a piece of skin from one side, putting it another. You don't have to ask for a special permission for that. All doctors can do that. In other words, you just need to know how to do it. Of course, in order to be able to carry out such a procedure, we need to set up specific equipment and work with qualified nurses and fellow doctors that know what they have to do.
What type of illnesses can you cure with stem cell surgeries, with this type of stem cell surgery?
None. We don't cure any illnesses at all. What we do with this procedure is achieve an improvement in the quality of everything in the body. It's a systemic improvement because the procedure consists of selecting the stem cells and teaching them how to differentiate. We put them back into the body by means of a drip, and the cells will go wherever they have to go and will repair whatever they have to repair. So after this surgery, the patient will get a younger liver, a younger heart, younger kidneys, younger everything, would end up having a better immune system, and will be able to fight off his own diseases, provided he does what he has to do. I mean, if we do this and the patient still takes drugs and still taking excess of alcohol and so on, he will ruin again everything that you would have done, but it'll take him longer to ruin it. So it's not designed for a specific disease. It's designed to internally rejuvenate the person. That's when it comes to the drip application. There's a second way to use the stem cells, and we do that, and it's legal as well, because there are many things that could be done, but they are not legal. And these are the ones probably you are asking about. But we can't do them, and we don't do them. Like putting the stem cells in a pancreas to get rid of diabetes. Technically possible, legally impossible. So we can't talk about this. We don't do it. But there are things that are legal. For instance, you can put stem cells in a knee. And if there's osteoarthritis, you can regenerate a little bit of cartilage, a little bit of bone, and then the knee gets better. So you can help fix osteoarthritis.
Wow.
So that is one application, for instance, local application. And also it's legal to mix stem cells with fat when you do fat transfer in plastic surgery. And this I have done also in the past. It's not my favorite because it doesn't fix health. It's only for beauty, but it's interesting. So if it's somebody who wants to have bigger breasts or larger cheeks or lips, and they do not want to put silicone, we can make a fat transfer. Take fat from a specific place in the body, where there's an excess of it, put it where they want it, and to avoid this fat to be reabsorbed again and dry again, so 2-3 months later the patient would look exactly the same as they used to, we enrich the fat with stem cells, again autologous stem cells. So the fat continues to live as if they always had it there. It's an interesting technique, but these are the only areas really. The fat treatment for plastic surgery, the treatments that are done for traumatology, for knees, for ankles, elbows, and so on, and the overall regeneration, which is the drip for rejuvenation.
So how many years can you rejuvenate? Can you,
our
10 years, 15, 20?
Our record so far has been 20.
20 years.
And the least has been 8. So it's probably an average of 15, or maybe 12, I'm not sure.
It's amazing.
Anything between 8 and 20.
How often do you have to do the treatment? How long does it last?
It lasts because you start up again with this new biological age. So as you age. I mean, 10 years later, you'll be 10 years older.
Yeah.
So if you want to repeat it 3 years later, you can. If you want to wait until you are 10 years older, it's your choice.
So can you do the treatment multiple times?
Every 6 months it can be done.
Every 6 months. Is there a limit?
Every 6 months, that's the limit.
Okay.
There's no more. It's like Botox, more or less. Every 5-6 months it can be done again.
Yes.
Let's say that.
Okay. Can you also use this as if you have to get new skin as well?
Yes.
Completely new skin.
Yes, it's used for that as well.
What is the difference with your technique compared to other techniques? Is your technique painful? Is it
the difference between my technique and other techniques is the main difference, the most important one, because the others are minor issues, is that we do not freeze the bone marrow and ship it to a lab wherein they would cultivate the stem cells, and 10 days later they would freeze it again and send us back the stem cells, so we get the patient again, another surgery, and put the stem cells in. This is what almost everybody else is doing. What we do is we set up our own lab in there. We take the bone marrow, we do the whole procedure, no freezing. I personally don't like freezing, especially when it comes to internal rejuvenation, because part of this cell called fibroblast, I need it. And when you freeze, you destroy almost all of it. So it becomes useless for that. It's useful for other things, but not for what we pretend to achieve. So I prefer to work fresh cells. And we do that by setting up our own lab. This way, and again I say this is better than other ways, we avoid labeling mistakes. I'm not saying that the labs are making mistakes all the time, sending back stem cells that belong to another person. But human errors can happen. If we are handling just one patient at a time, and we're only handling one type of stem cells in one room, it's completely impossible to put back in that person cells that belong to somebody else because they don't exist there. So that's the second advantage. The third advantage is we do it all in one day. In fact, we do it all in less than 1 hour and a half. So we don't have to get the patient twice to the clinic, and it's quite quick. Fourth advantage, it's pain-free. We use a local anesthetic, very similar to the one that's used by dentists, and the patient doesn't get to feel what we are doing. We do it non-invasively, and this is the motto. This is our logo. This is our philosophy. All the medicine we do is pain-free almost. When you prick a finger, it causes a little bit of pain, and minimally invasive, even the surgery. If anything I can achieve to help people, as a doctor, I'm always happy to do so. But there's one thing that it's like not bothering me, but I consider it's very important for people to get to know that it is possible to prevent the majority of diseases. So I'd like to highlight the importance of preventive medicine. It doesn't matter if they like me or not, or if they believe, as you say, that I'm good at looking at blood. Good preventive medicine is good for everyone. Don't wait until you are sick to go to the doctor. Probably it will be too late. In the old times, 2,500 years ago, people used to go to the doctor whilst they were healthy. And they would pay the doctor to make them continue to be healthy. And if they became sick, they would go back to the doctor and get their whatever they gave him back, be it oil or wine or salt, what have you. They'll get their money back. Nowadays, it's exactly the opposite. You go to the doctor when it's too late. You need an emergency surgery. The doctor kills you at the operating table and still keeps the money, even if you're dead. So it's nothing to do with what our job used to be meant to do.
Yes.
And this is what I would like to recover, if you can help me do so.
Of course. And since you have gotten so many different aspects within traditional stem cell therapy, your stem cell therapy is a lot cheaper compared to others.
But it's a lot cheaper because I want it.
Exactly.
Like that. I mean, I could charge what everybody else charges, but yes, it costs less money, much less than what other fellow doctors charge.
Exactly, because the other doctor that knows this treatment, what does he charge?
$100,000.
$100,000
for the rejuvenation, but if it's for nervous neuronal therapy, surgery, it's $1 million.
Wow. And you charge?
15,000 euros.
Euros.
That's $16,000 or something like that.
Why is there so few people that does this technique when it's obviously the more superior one?
You have to study a lot.
It's a lot of practice.
A lot of practice as well. And the training, not many doctors have had the opportunity to be trained by fantastic stem cell experts. And I did have that opportunity, and some other fellow doctors as well, but not many. No, worldwide. It's not a popular technique, especially because I would even dare to say political and religious reasons, because in the past, the only possible or the only known stem cell surgery was done with embryos.
Embryonic
which meant abortion, which meant church saying no, it cannot be done. Church would obligate the government to say no. So no medical advancement. But I don't do that. I wouldn't do it ever. What we do are adult stem cells. We are not killing embryos to do it. But still, the law is the old one. And many doctors and many governments and many religions don't have the new information that we're not touching the embryos, that it's your own cells, that we're just manipulating them. So there's a lot of lack of information, even to doctors.
Are there any downsides to this treatment? To your treatment, that is?
Zero.
Zero.
Zero because it's autologous. No risk, no contamination, no side effects, no possibility of rejecting the cells. No.
Are you working on any other breakthroughs at the moment?
Yes, we are working on nanotechnology in two areas of nanotechnology. One of them is with a group of oncologists in Italy that they've done the first trials on humans already to treat cancer using nanotechnology combined with heat simultaneously. It's very promising. It's not ready yet. I think it'll take a couple of years more. And the other area we are working in, it's not my favorite, but I always find myself ending up there. It's related to beauty, and it's external rejuvenation by means of nanotechnology, using nanoparticles that you could absorb through your skin using this specific technology. This will be ready very probably summer next year.
Summer next year. And what kind of aesthetic treatment is it? Do you remove wrinkles?
Yes.
Yes?
Yes.
Can you increase volume in the face?
Yes.
Can you rejuvenate everywhere?
You can do, to put it simple, you can do anything, whatever you can achieve with a needle, and anything that you could put in a needle, you do exactly the same without a needle.
What other things in the field of medicine do you think is very exciting happening right now?
In the field of medicine, more and more doctors are accepting and allowing for supplements to be used, for diets to be adjusted, although we are still behind schedule. There's a lot to do there. Also in robotic medicine, in medical equipments, in especially when it comes to diagnostic tools. Beautiful ultrasounds are being manufactured. PET scans, very precise. So there's a lot happening. And for cancer treatment, photon treatment and other sophisticated machines, oncological hyperthermia, especially the one that's manufactured in Italy, 13.56 megahertz, which helps the oncologists to reduce the sizes of the tumors or even eradicate them. And they can combine this technology not only with what they are doing in Italy with nanotechnology, they can combine it with chemotherapy, they can combine it with natural medicine, they can combine it, depending each one what their specialty is, with other methods, and make the most out of other methods. So there's a lot happening. Not enough.
Not enough,
a lot.
but a lot.
A lot.
There's also a lot of happening in biotechnology as well.
Oh yeah.
Yes.
This is the future.
This
the,
is
the near future.
Yes. Very exciting. And then, how many clinics do you have around the world now?
So far, 8. Soon there will be 9. And finally there will be 10 and full stop.
Okay. What's the name of the 9th one?
Alexander, I think you should mention it because I don't remember it. I'm not going to be far from here,
No.
but you've already come from there, so you would remember the name.
Yes, because the 9th clinic is the clinic in Elysium Medical in Oslo, Norway. We are very happy to say. So Dr. Hilu will be delivering his services in Elysium Medical in Oslo, Norway. That will be sort of your center in Scandinavia.
It's going to be my pleasure.
So, and the good thing, there's not a 2-year waiting list. So,
oh yes, it's immediate.
it's
service.
immediate.
It's immediate.
It's right away.
Yes.
Which is fantastic. So,
But sadly, it will soon be,
of course,
with a long waiting list.
yes. So be quick.
Because there are not so many clinics as yours offering such services.
No. And as well, you will be able to get the stem cell surgery and the cellular biology as well.
Exactly.
So, fantastic. We are really looking forward to this.
Me too.
And we have a big, it's always fun to work with something that has a big purpose and be able to help a lot of people around the world. So thank you, Dr. Hilu.
My pleasure.
It's been a pleasure. It's an honor.
Thank you.
Thank you for your time. It's a pleasure to do. We are looking for the bright future.
All right. See you in a few months in Oslo.
In Oslo, Norway. Yes.
Thank you, Alexander.
Thank you.
Have a good day.
You too.